All right, welcome to Health 2.0. I'm Steve Wretling, the Chief Technology and Innovation Officer for HIMSS, and I'm absolutely delighted to spend the next few days in Santa Clara together with all of you. And if you look around, we have some of the brightest minds in healthcare technology in this very room. We have pioneers in health, those that are at the front line of working to transform healthcare. So I'm really honored to welcome you to this year's event. And we're going to be working on a lot of things and accomplishing a lot together over the next few days. Everyone in this room is working to empower and enable patients to live healthier lives. And in each of your respective organizations, you are working on some of the most critical issues we're facing together in healthcare. I've also had the privilege and responsibility of being on the front lines of healthcare as well. Earlier in my career, I developed healthcare technology and led projects like clinical and patient care management tools, a mobile app that's being used by about 6 million patients today, disease management, population care management system that had about 10 million patients under care, as well as a specialized electronic health record focused on kidney care. And one of those experiences really underscored for me was the importance of putting yourself in the shoes of the patient, the provider, the caregiver, the administrator, as well as putting the question, why, at the top of your mind when developing new technology. Why is this important for the patient? Why shouldn't the patient have access to this information? Why do we need to have this data available at the point of care? Asking why has given me the perspective to innovate. And while I still believe in putting the patient at the center of everything we do, my role at HIMSS has given me the opportunity to have a new perspective on the industry. So while I was on the front lines before, now I've got the bird's eye view. And I can say unequivocally that this is really an exciting time to be involved in healthcare. In the past year alone, we've seen all kinds of new trends, new technologies, new capabilities, new companies, IPOing, coming to market, as well as we've seen a continuation of things that are going on in the industry. And so this spectrum of new technology, these new capabilities, these new solutions have been a tug-of-war of payment models, policies. We've seen tech-enabled services take a step forward. We've seen interoperability standards stand up from a US perspective and talk about internet-based approach, APIs. We've seen AI move from a buzzword to actually being techniques that are added as algorithms through the process into decision support systems, into the systems that aid and enable physicians and patients to provide care. As well, we've also seen a dedicated and serious effort to address social determinants of health that have long been ignored. So things like access to transportation, things like focusing on reimbursement for simple things like a handlebar in a shower that we all know has been needed, but is finally coming through, or the focus on getting the data around patients' access to food, clothing, even questions about their personal safety, things that are really simple, but make a really big difference in the process for patients for healing. And so, with all these changes going on, companies are trying to find and understand their position in the new health economy. So they're grappling with what are these new technologies and changes doing to their business model? How will they have to shift their business model? How and when and why? They're also trying to understand who their competitors are, who their allies are, who the competitors are that are now partners, many of which are one and the same today, which can be really, really confusing. And we're also seeing and continuing to see a lot of new investment from traditional private equity, venture capitalist firms, as well as health organizations jumping in to try to fill gaps, but also create new markets. And so there's been a lot of movement, there's been a lot of conversations, and in these conversations, what stood out most to me is that there's a lot of focus on the how and the what. And that's understandable, given the fact that invariably companies are trying to figure out what gaps they're trying to fill, how they're going to bring something to market. But let's not forget about the why. Many years ago, when I developed a telehealth solution or developed clinical analytic solutions, the mobile app, if I didn't ask why, we probably would have ended up with a video solution that didn't do much. And we've seen a lot of disappointment in some of these arenas because we wouldn't have understood the care process, understood what really was needed for the patient, the provider, why it was critical for them to get what they needed in that care process. So understanding the why is very important. It's how you're able to innovate. And it's not just enough to identify the gaps to set yourself up for differentiation or position yourself for success. Why, asking why, is so critical. So we're going to be exploring the question of why over the next few days here. It's going to be a big part of what we're addressing. We're going to showcase a lot of cool technology, as normal, a lot of demos. We're going to engage in the dialogue around big, revolutionary ideas, and also practical solutions that enable the delivery of care. And when you return to your respective organizations, hopefully with refreshment, being inspired with the exchange of ideas, your journey is going to continue. And HIMSS is here to help you understand the changing landscape, to help you understand what's going on with the evolving set of care models that are enabled through information and technology. And we're here to help you understand the why. But you don't have to do it alone. You can reach out, you can get involved. We have multiple forums all through the year, thought leadership opportunities and education. We also have membership opportunities, committees that are moving with the pace of change, as well as allow you to connect to new resources, things like policy conversations, advancements in tech, how data is being used, how tools or opportunities with technology to improve patient care, as well as some of the newer conversations on finding efficiencies. We're available 365 days a year, and our doors are always open. And for the next few days, I challenge us all to ask and bring to the front the question, why? Because the more we ask why, the more we're going to be able to innovate, and the closer we can become to transforming healthcare in patients' lives. And so I'd like to thank you for your time. And I'd also like to thank our sponsors and our partners in innovation